All right. Hello, everybody. My name is Sean Quincy, and I am a Deputy County Administrative Officer in the Humboldt County Administrative Office. One thing that we are going to try to do more regularly is to try to get more updates from the board so that we can talk about some community concerns that are arising as we go through the COVID-19 epidemic, or pandemic, I should say. And so before we answer a couple questions, we'll take probably 5 or 10 minutes to do these videos. And before we start answering some questions with Chair Estelle Fennell, Estelle, is there anything that you want to talk about? Anything you want to say before we get started?
Well, Sean, I think the most important thing to remember here is that information is everything. Aside from doing social distancing, most people know about that. But I think people are really hungry for whatever facts we can share. And so we want to be as absolutely transparent as we possibly can to give you as much information as we possibly can. And a lot of us now are observing the social distancing, the staying at home. So we're doing most of this via Zoom, but I think it's very, very important for people to be kept up to speed. And I really, really appreciate the efforts that everybody at the county has been making to make sure that we can keep that information going.
Yeah. Okay, good. So with that in mind, we'll kind of just jump into some questions. We'll probably get, maybe 3 or 4 in today. First question that we have is, how are county employees being impacted by COVID-19? And have any county employees tested positive? And if so, what's being done to protect them and other county employees?
Well, Sean, as you know, our highest priority is keeping our employees safe and our families and the people that we serve. And actually, yes, recently a number of county employees have tested positive for COVID-19. Public Health is investigating the transmission and is looking to see whether clients and other employees should be quarantined or tested as well. So anyone who needs to be notified will be notified. That is what Public Health does. They do a very thorough job of tracing down any kind of contacts a person with the positive test has had. So that's ongoing as we speak with any cases that we turn up in during our testing. So, Sean, as I said, we do have a few members of the county employees now who have tested positive. And of course, this hits very close to home for us. And we are wishing all involved a full recovery. For those employees and anyone who may have come into contact with them, the standard protocols do apply. And that means anyone who has been tested positive should stay home and monitor for symptoms, and that will be for 14 days. And then close contacts should do the same. So contacts of contacts can remain at work, so that 2 persons removed while monitoring themselves for symptoms. And the CAO's office also asks impacted employees with questions or concerns to email the employee contact, which would be employee covid.info@co.humboldt.ca.us. Again, just want to say, we're all, we can become scared, especially when we hear that somebody we know, love, work with has tested positive. Not everybody has really severe symptoms, but they can be very contagious. So this is the big key right now, is to keep ourselves removed from each other. And as I said, that second level is somebody who may have been further than 6 feet away from someone, but they should at least keep an eye if they know that somebody they know has tested. So we're keeping an eye on that and sending, again, our best wishes and doing everything we can for everybody, and of course for our employees as well.
Yeah, and employees should also know that we have a couple resource pages set up on the county's website and the county's intranet, where employees can get more resources, to talk about telecommuting and their benefits and things like that. So we're trying to put out a lot of information from the staff level as well.
Yeah, I think that piece of information, I got a copy of that. It's very, very helpful and very thorough. So, that's one of the things I've talked a lot about, Sean, is that during this process, there's a lot happening in the background. Everybody's working nonstop on making sure that we're as thorough as possible.
Yeah.
And again, I want to thank everybody for putting that information together.
Yeah. All right. Question number 2, should we as members of the public be doing anything different now that coronavirus is spreading through our community via community transmission?
Sean, we've been saying this before, but it definitely is worth repeating as many times as we need to. And that is that we have to continue with the protocol that we've set in place for a while now. So yes, case counts do continue to rise in Humboldt County. The cases now being identified could likely just represent the tip of the iceberg of the spread that could be happening in our community. So, according to Dr. Frankovich, everyone has to behave as if every social interaction has the potential to contract the virus. And that's the reason for minimizing that social interaction as much as possible and using all those precautionary measures. The New York Times now reports, believe it or not, that half of humanity is under lockdown. So we're trying to take this in as gentle a way as possible. We're trusting the residents of Humboldt County to understand the gravity of this. And as we know that it is spreading, we just really do need to be careful. And I said this yesterday in an interview with Sean, people are keeping that 6-foot distances. The shops are doing a very good job. They're marking where you stand, et cetera, et cetera. But it's a human kind of response to get a little closer when you're talking with someone. And just please try to not give in to that and keep that 6-foot distance, because that's really, really, really a big deal. So yeah, that's what we need to be doing right now as we see the potential for community transmission.
Yeah, so the basic message, kind of keep using the precautionary measures, the social distancing, covering your coughs, washing your hands, things like that, right?
Yep, absolutely, yeah.
So the third, and I think this will probably be our last question as we kind of wrap up, should we, we're getting word today from public health and the health officer that word about face coverings, and should everyone in the community be wearing some sort of face covering when they go out in public now, and not just healthcare workers and those kind of on the front lines?
Well, people have been asking that question for a while, and there is mounting evidence that COVID-19 may be most contagious in that brief period before the infected person becomes symptomatic. So at this point, public health and government officials are changing their position on the value of masking for healthy people. That's asymptomatic people. They may have the virus, but they don't know it yet. And so the California Department of Public Health now recommends the use of cloth masks for those that are healthy, but they emphasize that social distancing and frequent hand washing and sanitizing remain the most important actions individuals can take to prevent the spread of COVID-19. The state does not recommend the use of N95 and surgical masks because those are needed for medical professionals and first responders. I mean, that message has to go out. It's unfortunate that we don't have more of those supplies on hand. But right now, as we learn, in other jurisdictions, in other areas of people who work in the healthcare professions becoming infected, it's extremely important that we protect those people that are putting themselves on the front lines. So again, the idea is wear that mask. People are making those right now. A lot of people are at home sewing masks. Wear those masks to stop yourself from spreading, but don't take the tools away from the healthcare professionals. I think that that's a good way for people to go.
Yeah, so it seems like the big distinction is the healthcare professionals are to wear the N95 masks.
Yes.
But if you're just a member of the public, you're asymptomatic, feel free to wear a cloth mask, even a bandana, something like that, a homemade mask, even scarves. I've heard Dr. Frankovich talking about just something to kind of cover your mouth to prevent the spread of these things. But the N95, the surgical masks and things like that, those are not necessary for just
No.
general members of the public.
So generally speaking, I think that people have been asking about this for a while, and at this point, we really do, both at the county level and the state, recommend that people do wear those masks, especially if you feel you need to.
Okay. Okay, great. Well, I think that's going to wrap up the questions for today, Estelle. Thanks for taking the time. How are things going for you personally? Can you talk just a little bit about how you've been affected by the shelter-in-place orders and some of the ways it's affected your life?
Well, Sean, it's kind of interesting. I was saying this the other day. We have a lot more to deal with now than we do on a daily basis.
Yeah.
A lot of us are working mostly from home, and it can be a challenge sometimes, because you're balancing all of the other things you do at home. But bottom line, it's working out fine. I feel it's, I can go out and take a walk when I need to. I think what I see more of Facebook now than I usually do. There, look at me, I just touched my eye. I shouldn't be doing that. But luckily I washed my hands
There you go,
before
there you
I
go.
talk, and I will wash them again as soon as we get off this call. But I think that being at home, being conscious, you can actually take those protections a lot more. And so for me, it's just balancing, getting that information out, answering people's questions, being the kind of like the liaison between the OES, the EOC, and the community. And I can't say enough about the community and how well they're responding. So, it isn't very thought-provoking for people. I'm sure we're all going to become household philosophers over this time. I see people sharing how deep this is for us.
Yeah.
This is something we'll be thinking about for a long time. And it will give us an opportunity to talk about what community is all about. And people are really doing well with that.
Yeah.
So let's stay focused on that and help each other, and we'll keep you as informed as possible.
Great. Okay. Well, thanks for taking the time, Estelle. I appreciate it. And take care, okay?
You too, definitely. I like that room.
Thanks a lot. All right. Bye-bye, Estelle.
Bye, Sean.